Have you ever noticed those little squiggly lines, dots, or cobwebs that sometimes drift aimlessly across your field of vision? You're not imagining things. They're called eye floaters, and they're especially noticeable when you stare at a bright, plain surface like a clear blue sky or a white computer screen. So, what's really going on in there? According to the NHS, it's typically just a normal part of aging. Your eye contains a jelly like substance called the vitreous, which makes up about 80% of its volume. As we age, this gel changes. Ophthalmologist Danielle Polia explains that collagen fibers inside the gel can clump together. These clumps cast tiny shadows onto your retina, the light-sensitive tissue at the back of your eye. What you perceive as a mysterious floating object is actually just one of these shadows. For most people, it's a completely harmless process. But what happens when harmless suddenly turns serious? While many people simply get used to their floaters, experts issue a critical warning. Never ignore a sudden increase or change in what you see. Dr. Polia stresses that any new visual disturbances should be examined by a professional right away. Why the urgency? Because in some cases, these floaters can be a red flag for a retinal tear. There's about a 5% risk that this condition could develop into a tear. And if a tear does occur, the danger escalates dramatically. Dr. Polia estimates there's a 50% chance of it leading to a retinal detachment, a severe condition that can cause permanent blindness. While treatment like laser therapy exists for severe floaters, it carries its own risks. The key takeaway is simple. If you notice new floaters or changes, see an optometrist or ophthalmologist immediately.